Alright guys, so today's video is just talking about some of the questions that hover around the PPD testing for tuberculosis. So just as a reminder, that is when we inject purified protein derivative of TB antigens into the skin and measure how large the induration is after 48 hours. I really hate this test. If in case you needed any reason, just order the QuantiFERON Gold test instead of the PPD. It doesn't waste resources. It's not a subjective test. It's more reproducible. So please just order that instead. But nevertheless, you see this on test questions all the time. And so if you're taking any kind of boards soon, I would definitely memorize the UWorld table for this. It's essentially just using statistics to predict whether someone has latent tuberculosis. And just as a reminder, if someone does have latent tuberculosis, you're going to order a chest x-ray and then treat them as needed. So some of the vignettes to really know are a family member who lives with someone who has diagnosed tuberculosis, a person who recently moved here from India or Vietnam, someone who works in a hospital or a correctional facility, aka a prison, and then just normies. That's about it. Anytime one of these protocols changes, you really need to know about this. So if you've been reading any kind of boards resources, med bullets, AMBOSS, first aid, etc., they still are saying this isoniazid monotherapy thing. The CDC has changed this, so it's now rifapentine plus isoniazid, and that only takes 3 months. So you're basically guaranteeing adherence. So a 34-year-old woman comes in. Her father was diagnosed with TB. I guess I should have mentioned, this question's implying she lives with them. TB skin test reads 6 millimeters. She does not work in a prison, nursing home, or hospital. She does not have HIV. She's not immunocompromised. Now, the thing I was trying to do here, which I don't know, hopefully you picked up on, is despite the lack of all these risk factors, she still basically lives with someone with TB. So anything over 5 millimeters here is positive. So what do we do next? We're gonna order a chest x-ray. This is the same table. So we have a person, blah, 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 I'll let you read this, but new onset nocturnal cough. Whenever you hear new onset nocturnal cough, you want to think either asthma or GERD. Now, this person's already been treating for asthma, so what you would do here is basically reevaluate their asthma, make sure they're compliant with their regimen, and then try them on a PPI for a few weeks, see if that helps. If it doesn't help, you can reevaluate with pulmonology, but I'm really seeing test questions nowadays really lean towards this like diagnostic trial of PPIs for someone that's coughing at night or has a chronic unexplained cough. Someone with UC is coming in because their disease is not well controlled simply on mesalamine and diet changes. His doctor recommends a new biologic medication for ulcerative colitis. What needs to be checked before starting this new medication? So obviously this is a video about tuberculosis, but anytime you're starting a TNF alpha inhibitor, you need to screen for latent TB. The reason why is that TNF alpha inhibitors, they stop the Th1 response that helps hold TB granulomas together. It really is not important that you know this if you made it past step 2, but this is really this is a really important thing to know because more and more people these days are on Humira. It's a pretty common medication for lots of diseases now, as well as Remicade, good old faithful. So definitely think about this. You do not want to send someone into active tuberculosis just because you forgot to order a lab test. It's a really bad idea. 66-year-old male got here from the Philippines 1 week ago. He's screened for latent TB. In order to need treatment, how big does his wheal have to be? So the answer to that is 10 centimeters. This is a pretty common patient that you'll see in a family medicine clinic. I would definitely know this one. In summary, I would know the PPD findings for HIV, living with a family member who has TB, IV drug use, recent immigrant, work in a hospital, or just otherwise. Thank you guys. I hope that was helpful.